Good afternoon, and thank you for joining us for the second in the series of the 2022 Check It Community Conversations. Hi, everyone. My name is Ken Juby. I'm the Vice President for Communications and Public Relations at CEFCU, and I'll be your MC for today's conversation. Believe it or not, we're now in month 2 of the Check It Challenge, an evidence-based wellness and blood pressure management program that focuses on improving your health by making simple changes to prevent and manage high blood pressure. If you aren't taking the Check It Challenge yet, it's not too late to join. Learn more and sign up at heart.org/checkitny. And I've been participating and I'm pretty excited about it because I've been monitoring my blood pressure, and it's kind of motivating me to make some healthy choices and just be mindful of what's going on in my life. So I really encourage you to take a moment to sign up and just be part of the action. It really is a great way to make sure you're staying heart healthy. And for that reason, CEFCU is proud to be a Live Fierce, Reduce Your Risk sponsor for the Check It Challenge. And we stand beside all of the Check It Challenge sponsors who have joined together to address hypertension across New York State. And the sponsors include UHS, Fujifilm, the Kinney Drugs Foundation, PCSB Bank, Ellis Medicine, Baxter, Tompkins Mahopac Bank, and Northwell Health Phelps Hospital. And so thank you all for your support of the American Heart Association's mission to be relentless in our effort to create a world of longer, healthier lives. It really is an important mission and one that we know this initiative will support. So these conversations do rely on audience participation. So we want to make sure that everyone knows how to use the chat box function. So go ahead and introduce yourself, make sure your comments are going and that's for everyone, not just the panelists. So let us know, use the chat. Tell us what city you're joining from today, what participating company or organization you're with, and just feel free to share so we can get that dialogue going and make sure that when the time comes, we're ready to receive your questions and share thoughts back. So throughout the event, we want you to put your questions in the chat box. Go ahead, don't wait, just get them in there because we want to make this an engaging session and make sure we answer the questions you have. So we are going to hold all questions for a Q&A with the panelists at the end, but by all means, continue to submit them throughout the program. The American Heart Association staff will be taking notes and we'll get through as many of those questions as we can at the end. And a reminder for everyone, this is a public event, so please avoid disclosing any personal medical information. And today's sessions are being recorded and they'll be available on the Check It Challenge website, Facebook event page, and the American Heart Association's Eastern States YouTube channel for a few days after the event. And you can access the recording and all of the monthly content on the event website. That's heart.org/checkitny. And if you're using social media throughout this conversation, please use the handles you see on the screen. That's AHA New York and #CheckIt. Okay, so today's Check It community conversation, Eat Smart and Reduce Sodium, is presented by Tompkins Mahopac Bank. And I'd like to ask Carol Schmitz to do the honor of introducing our first speaker. Carol?
Thank you. Good afternoon, everyone. On behalf of Tompkins Bank, welcome to the second community conversation of Check It Challenge. I'm Carol Schmitz, the Senior Vice President, Community Banking Manager. I'm excited to learn more today about how we can reduce sodium in our diet, and even more, why that is important to do. Tompkins Bank is proud to present today's community conversation and to be a sponsor of the Check It Challenge. We have supported the American Heart Association for years. You know that investing in the American Heart Association is an investment in our staff, our customers, and by investing in the Check It Challenge, over 315,000 New Yorkers who are reached through this great program. Good health is important to me personally because it makes me feel better when I'm able to do my workouts in the morning and eat healthy during the day, and it just brings more energy and I can think better mentally. That's why I've been on the Hudson Valley Board of Directors of the American Heart Association, and I have served on several leadership teams for the American Heart events. I took a sneak peek of our first speakers today, who unfortunately cannot join us due to her class schedule, and I think you'll agree that we can all learn a few things at any age. It's my pleasure now to introduce Morgan Scott, CEO of Very Very Much. Very Very Much is an organic treat company created by Morgan Scott, a 7-year-old innovative entrepreneur with big dreams. With the help of her parents, she creates organic drinks, treats, and jams. Her items can be found at pop-up markets, birthday parties, events, and even lunch boxes near you. I hope you enjoy the program.
Hi, I'm Morgan Scott, CEO of Very Very Much. Very Very Much is an organic treat company in Syracuse, New York, and today I'm going to be making you a smoothie. And the smoothie is really healthy because my mom told me she's a nurse. So you're gonna use 1 cup of oat milk. Put it in. And then we're gonna use these Quaker oats. It says may reduce the risk of heart diseases, and you can have this ready for lunch, breakfast, or dinner. And we're going to use 1/2 cup of these Quaker oats. And the American Heart Association certified. And then we're going to use this banana. Put the banana in. Right in there. Break it up. And then we're going to use these things to sweeten it. All in. And then we're going to use these strawberries. MyPlate. And then we're going to use these blueberries. Then you're gonna press low on the if you have a Ninja one. Press power and then low. bananas for lunch, breakfast, or dinner, and enjoy this blueberry banana date smoothie. Thank you for joining the Check It Challenge, and thank you very, very much, American Heart Association, for having me.
I think Rachel Ray is going to get a run for her money. Very exciting and certainly a tough act to follow, especially because probably a lot of us want to get up and go make a smoothie or have some sort of healthy snack now after seeing that fantastic demonstration. But we've got more of our program coming up, and our panelists are certainly up to the task and ready to share some very exciting and important information with us today. And our first panelist today is Linda Altenberger. And Linda is a registered certified dietitian nutritionist who earned her Master of Science in Clinical Nutrition from NYIT and a Bachelor of Science in Dietetics from Oneonta State. Linda began her career as a clinical dietitian at John T. Mather Memorial Hospital and was promoted to the role of Clinical Nutrition Manager, where she led the clinical department for nearly 28 years. Linda recently received her culinary nutrition certificate from the Culinary Nutrition Studio in New York City. And for more than 6 years, Linda has served as the lead nutritionist for Cornell Cooperative Extension Community Education SNAP Ed program, serving low-income, diverse communities in need by implementing positive behavior change strategies for an overall healthier lifestyle. Linda is an active member of the SNAP Ed leadership team, and in early 2021, Linda's role expanded to include that of program manager for the diabetes program at CCE Suffolk. So Linda, I'm very excited to have a conversation with you because I know you have so much knowledge to share, and so it's very exciting. You've been a registered dietitian and member of the Academy of Nutrition and Dietetics for almost 35 years. So first and foremost, happy Nutrition Month.
Oh, thank you so much, Ken. It has been a wonderful journey for me being part of the Academy, which is the world's largest nutrition and dietetics organization. But first, before we move on, I do want to thank the American Heart Association for inviting me today to join this wonderful program and for being part of the Check It Challenge.
Of course. Now, so we're talking about this year's theme a little bit as it relates to Nutrition Month, celebrate a world of flavors. So Linda, what does that mean to you?
So the World of Flavors theme focuses on creating healthy habits that celebrate heritage, global culture, cultural foods, new foods, and various flavors. So as an RD, it empowers me to embrace an individual's favorite cultural foods and traditions and really show them how that these can be incorporated into their lifestyle and still meet their health goals. We have to remember that what we eat, the way we eat, and even the time of day is influenced by our culture, spirituality, religion, values, beliefs, regional foods, and of course, accessibility. So we have to keep in mind that each region has its own specialty in cuisine and cultural practice.
So Linda, we hear a lot these days about eating a balanced diet, and sometimes you might think, well, easier said than done, particularly as we're all on the run and juggling a variety of different things. But when you hear balanced diet, what does that mean to you? What does that constitute?
That's a great question, Ken. So I often point people in the direction of MyPlate when they're seeking to consume a balanced diet. It's a great tool and a resource developed by the USDA to help follow a healthy, balanced lifestyle. So variety in what we eat is key to getting all of the vitamins and minerals that we need. And MyPlate guides towards a varied plate containing foods from the different food groups. Now, fruits and vegetables should make up at least half of our plate, and grains, preferably whole grains, should make up a quarter, and the remaining quarter would be protein. Now, if you do include dairy in your diet, low-fat dairy can also be added to your meal as an accompaniment. Don't forget the healthy fat in moderation to be included in this healthy diet. So the MyPlate website provides many great resources on healthy eating. It provides healthy recipes and handouts that you can try at home. There's also a MyPlate, My State information, which shares what foods are local to different states and what each state is known for producing. Thereby, you could personalize your eating style with local flavor, local foods, and local recipes. And the best part is the local produce is more likely to be a little less expensive because it doesn't have to be transported halfway across the country to be sold. Lastly, the What's Cooking USDA Mixing Bowl and the SNAP-Ed New York websites offer healthy recipe databases as well. So just to finalize, creating a healthy plate, we want to focus on nutrient-dense foods as opposed to calorie-dense foods, which tend to have very little or no nutritional benefit. So lastly, variety such as vegetables, fruits, whole grains such as quinoa, bulgur, barley, so important, as well as lean protein. So like your beans, your legumes, fish and poultry. And lastly, your healthy fats represented by avocado, nuts, and seeds. Lastly, that variety ensures that our bodies are getting all of the antioxidants, micronutrients, and vitamins and minerals for a healthy body. So it's so important. So when we talk about when we are eating in this fashion, like I just described, we're more than likely consuming a lower sodium diet, which is so important for healthy blood pressure and also reducing your risk of other diseases. Now, as you likely know, salt and sodium aren't the same thing. So when we think about salt, visualize the salt in your salt shaker, and that's comprised of both sodium and chloride. On the other hand, sodium is what we reference when we look at our nutrition facts label, which indicates the amount of sodium in a particular food. Now, most Americans consume around 3,400 milligrams and even more a day of sodium. Despite that, the FDA is recommending to consume less than 2,300 milligrams of sodium a day. Now, that's about 1 teaspoon of table salt. So consuming too much salt causes us to retain fluid. It results in some swelling and causes our hearts to have to work harder overall, which also increases blood pressure as well as your risk for stroke. Now, extra sodium in the diet also draws calcium from your bones. That leads to osteoporosis. And most concerning is over time, the impact that this extra sodium has also negatively affects your kidney function. So most important, making that conscientious effort to manage sodium in your diet is going to pay off big time in the long run.
So I think one of the things that we also, like people, and maybe it's just force of habit or things you learn when you grow up, you know, even sometimes people, even before they taste their food, will throw some salt on it, just for what you might deem as flavor, to spice it up a little bit. But there's different ways to do that. And so there's been a lot of discussion recently about the importance of adding herbs and spices to our food. So Linda, what is your thought on that?
Thanks, Ken. That's a great question too. So herbs and spices have been shown to fight inflammation, enhance our immune health, and even reduce cell damage. And this is because they're so rich in phytochemicals. Those are the compounds only found in plants. Now, the antioxidant properties of herbs and spices, however, they've been studied, and they really have come up with varying outcomes surrounding different health conditions. So more definitive research is really required before specific recommendations supporting the benefits of herbs and spices in the overall maintenance of our health and protection from disease. However, it's always great to aim to cook with herbs and spices routinely as you like for optimal health benefits. So some of my personal favorites that I tend to use most often are turmeric, ginger, and garlic. And by incorporating different herbs and spices used internationally, you can add unique flavors and sort of do away with the need for salt, because you're kind of preventing the boredom from happening. And it also perhaps limits your need to add extra fat and sugar as well. So using the herbs and spices can help with our heart and digestive systems as well. So it's important to keep in mind, this is really important, that you have that communication open with your physician, your practitioner, because certain herbs can affect medications that might have been prescribed by your physician and even over the counter. So there are some safety concerns, and you just, again, keep in mind that you do have that conversation with your doctor on that level. That goes for supplements too, for that matter. Now, the DASH diet, known as Dietary Approaches to Stop Hypertension, developed by the National Institute of Health. The evidence behind the DASH diet eating plan shows that it's helpful to prevent heart disease, stroke, diabetes, and even certain types of cancers. And the clinical trials that are out there have demonstrated lowered LDL, which is the not so good cholesterol, as well as total cholesterol levels, which are major risk factors for cardiovascular disease. So again, because it emphasizes vegetables, fruits, mainly processed, minimally processed foods, the DASH diet can also help with persons looking to lose weight. In fact, the US News and World Report ranks the DASH diet as the #1 rated diet. It kind of tied with the Mediterranean diet for best diet for healthy eating, as well as best heart healthy diet. Again, the DASH diet is full of natural, healthy foods, and it notes recommended serving sizes depending on an individual's calorie needs. Now, calorie needs are determined by your age, your level of physical activity, and whether or not your goal is to lose weight or maintain weight. Now, keep in mind, the DASH diet recommends between 1,500 and up to 2,300 milligrams of sodium. And this depends on, your medical history of what's going on with your blood pressure. Of course, the lower range is going to help you to lower your blood pressure even more significantly. The DASH eating plan emphasizes, again, as a refresher, low in added sugar, sodium, saturated fat, including trans fats. It's rich in potassium, calcium, magnesium, fiber, and protein, and that's from your veggies, your beans, your whole grains, fruits, and also low-fat dairy, and mostly avoiding those highly processed foods.
Linda, what are some easy, healthy swaps and suggestions that might allow us to add more fruits and vegetables to our meals?
I'm going to share some of my personal favorite swaps, in particular for recipes. So I love using applesauce or even like a prune sauce in place of oil when you're doing some baking. It's a 1-to-1 substitution. So if the recipe called for half a cup of oil, for that matter, you can easily just substitute half a cup of applesauce. So simple and easy. And most everyone has applesauce in their home. Now, dates and cinnamon are great to reduce sugar in recipes. Again, another one of my favorites, avocado or even beans. If that's pureed up, you could substitute that in place of butter as a 1-to-1 substitution. And lastly, plain Greek yogurt. You won't even notice the difference in place of sour cream. So those are some of my favorites there. I also love to add, I kind of clean out my refrigerator. So whatever veggies I have on hand or often frozen work really well too. Chopped veggies or even beans added to casseroles, stews and soups. You get an increase in fiber, protein, and enhanced nutrition all in one. It's a great way to kind of hide in some healthy nutrients if your family isn't into a whole lot of veggies and things like that, especially if you rice it or puree it up. Also, too, if you don't currently have a salad, try having more salads during the day, whether you have that at lunchtime or dinner time, and include all of the colors of the rainbow. So your reds, your blues, your yellows, orange and such. And if you're already having a salad, make sure that you're getting all of those components or add in some healthy fats too. Lastly, give your body a healthy start in the morning with breakfast. Consider adding fruits or vegetables to your breakfast. You can add fresh fruits like berries to your yogurt, add it to your cereals, add it to your smoothies. And veggies are still a great way that you could sneak those into your omelets, whether it's spinach or kale, or add it to your smoothies. So those are some of my quick tips that I try to do pretty much every day.
Linda, having come from the clinical side, why do you think it's important to engage a registered dietitian, nutritionist, or an RDN in someone's care plan?
So remember, RDs are an integral part of the patient-centered model of care. They evaluate, they assess, they educate, monitor patients one-to-one, providing personal recommendations in line with their medical and family history, also including biometrics. And that's really their focus, really trying to work one-on-one with the patient.
So how would you find an RDN that specializes in your condition, whether it be hypertension, diabetes, or something else?
So there are several ways. My first suggestion is that you do reach out to your insurance company, because typically they are going to have a listing of RD providers within your plan. You can also check with them to see if a referral would be necessary. If they don't have either that coverage or a listing of nearby providers, definitely go to the Academy's website, which is eatright.org, where you can click on the tab that says find an expert, and then you'd enter your zip code and credentialed providers according to specialty come up. So it's really quite easy that way.
Linda, how would an RDN help patients achieve their health goals through food?
Yeah, so RDs are held accountable for adhering to the professional standards of practice and ethics to provide medical nutrition therapy. So after identifying a patient's health goals and considerations for food allergies or cultural preferences, that's when a personalized plan is developed together with the patient. So this empowers them and it helps set up the patient for success. Now, typically patients are followed and monitored and evaluated routinely. And again, it's the small manageable steps that clearly lead to long-term success.
Okay, so just switching gear a little bit here, for folks that maybe who aren't familiar, can you explain what SNAP Ed New York State is?
Sure, that's a great question, Ken. SNAP Ed New York State is the education component of the Supplemental Nutrition Assistance Program, known as SNAP. And SNAP Ed is a federally funded program through the USDA, and it's administered through the New York State Office of Temporary Disability Assistance. The program targets SNAP recipients and SNAP eligible individuals who are at risk for food insecurity in vulnerable communities. So SNAP education complements SNAP program by providing nutrition education and implementing proven obesity prevention strategies by way of policy, systems, and environmental constructs. Now, the SNAP Ed strategies focus on both healthy eating and active living interventions, also direct nutrition education, and even social marketing promotional campaigns. The goal of the program is to ensure that underserved individuals and households are able to make healthy choices within a limited budget and to choose physically active lifestyles. So SNAP Ed strives to partner with and influence many types of entities and settings where people eat, live, learn, work, and even play.
Linda, thank you so much for all the information you provided to us today. Lots of great info and certainly some food for thought. And of course, if you have questions, if you've heard some things from Linda that make you want to ask some questions or have different ideas, put them in the chat box for our Q&A session. Because right now it's time to move to our last guest, Elly Wilson. Now, Elly's a registered dietitian, nutritionist, and manager of lifestyle and wellness programs at Price Chopper Market 32 at the Golub Corporation, which is located here in the Capital Region in Schenectady. And Elly's passionate about the power of food to enhance wellness and works to connect shoppers to nutrition information and inspiration at every opportunity. Elly develops and manages nutrition data and food and health resources for the chain of 130 stores and supports pharmacy, quality assurance, and private label, PR, human resources, and sales and marketing teams along the way. She's also a food service rotation preceptor for the Troy, New York-based Sage College Dietetic Internship. And finally, a longtime volunteer here with the American Heart Association. So Elly lives in Schenectady with her husband, Walter, and their son, Don. Elly, great to have you with us today. Thanks for being here.
I'm so thrilled to be here, and really thanks again to the Heart Association for including me today, because it is quite true that inspiration is also part of what dietitians do to help, just like Linda was just describing, kind of pull people towards that healthier lifestyle through that world of flavor. I mean, we kicked off today with a recipe for Chipotle lime chicken, and then Morgan, I love seeing how Morgan did her recipe and you realize, the more children learn how to make food, the more choices they have. If they're only stuck with what's being given them and they can't actually prepare food, they have fewer choices. So good for her. She is rocking it.
She sure is. And it's exciting to see. And again, we've got lots of great information to get to with you, Elly. So let's start with this. In the first week of National Nutrition Month, I caught that one of the to-do items was to learn how to read nutrition facts labels. And sometimes that's easier said than done. So can you tell us a little bit about that?
Sure. So the nutrition facts labels are really part of legal labeling. There was a time when foods did not have to be labeled, so you didn't know what the ingredients were or what the nutrients were or sodium amounts, et cetera. So this is a big opportunity for us to really understand a little bit more about our food. And there are some quick tips and just some things to keep in mind when you're looking at a label. The first thing, and there's a great handout about this on the American Heart Association website. So under their healthy living section. So the first is to start with what's the serving? How much food are they talking about? Because more often than not, something in a package may or may not be more than one serving. So you want to know, how much are you talking about here? Serving size can be one of the ways that you actually really help manage how much and how often you eat something. That means that we can also help balance what we eat a little bit better, and that nothing is really a poor choice. Again, it's just a matter of how much and how often. When you look at that label, again, another thing to look at is total calories, right? If you see that the serving size is a quarter cup, but the calories are 500, that's going to make you maybe look twice, because our recommended average is based on 2,000 calories. If you're getting a quarter of your whole day's calories in half a cup of food, you might want to take another look or see how you balance that with other items. The next would be really looking at the nutrients. And today we're really focusing on sodium. So when you look at that sodium content on the label, the number you want to remember is 140. 140 milligrams is the legal guideline for a low sodium food. So 140 and under is a low sodium item. The other way you can keep an eye on that is to look on the right-hand side of the label. We have the daily value percentages. So trying to keep that number as close to 5 as possible, meaning 5% of your daily value, is another way to just quick look at that label, not get too overwhelmed by it. 140 milligrams or 5%. And if you're looking at an item that is a whole meal, the American Heart Association recommends that you look for sodium content that is 800 milligrams or less. A lot of the prepared foods and frozen meals that you can purchase at the store now are actually more around 600, especially if you stay in the companies that are more health focused. So keep an eye on that. And those are like 2 easy ways to get through reading that label. And then the rest of it is at the bottom of the label, there's 4 nutrients that we really want people to be paying better attention to. That is vitamin D, calcium, iron, and potassium. So you want more of those. You don't want to see 0. You want to see 10%, 5%, 20%. Those are, a way to go back to what Linda said about nutrient dense foods. That means that for that serving, you're getting a lot of nutrients. That's a good fit.
Okay, so as we're getting to the grocery store and we're thinking about our meal prep at home, what's your recommendation for the best way to build a grocery list to do healthy meal prep?
Well, you already actually said it, and that is 1, make a list, right? Just, how often do you get there? And there's always that little meme that says, often we write the list and then we leave it home. But even that can be something that helps you as you go through your store. Think about what you usually like to eat, and then try to learn a little bit more about your ingredients, et cetera. And you don't have to change everything to eat more healthfully. Really, it's more about tweaks and nudges, looking at what you're already making. How do you balance it a little bit? For example, one of the things you can do with that MyPlate model is just double or triple the fruits and vegetables you have in a meal, And you might resize a little bit some of the other things you might have in that meal, but you haven't even done anything different and you've already tripled your produce. This is a really great move. Another way to make sure you're building that list is looking at what's already in your pantry, making sure you have a good supply of things like the oats that Morgan had on her recipe. You can have a great selection of no salt added canned fruits and vegetables. They are very much part of making healthy easy because they're already prepped and they're already familiar to you. You already enjoy them. Things like canned beans, great opportunity to add protein and plant-based protein to any kind of meal or casserole or soup. You can literally soup up your meals and your snacks and your salads by having some of those things on hand. The other way that getting to the store can be helpful to you is look at the store resources. They may actually have a shoppable recipe program where you can look at the recipes, look at something you might want to try like Chipotle lime chicken, and then you can actually put those ingredients right into your shopping list. So there's, definitely a lot of different ways to do this, but just start with what you usually do and how could you tweak that a little bit to make it a little bit better for you. I think one of the biggest challenges for people is the belief that they have to eat differently. And then it seems as though there's too much to change when really, just like Linda was saying, our better strategies are to start small, make some swaps, make some tweaks to quantities and servings and seasonings, and those will help us move forward. And flavor is really one of the biggest parts of that. When I taught cardiac rehab, that's often when people have had an emergency and they're trying to make a lot of changes because they've had a health emergency related to their heart. And that can be a time when people really struggle and they really find success when they work with the dietitian through that program and get some of these tweaks and hacks and tips that work in their life. That is what dietitians do. We really work to bring that science and flavor and health all together to make it very accessible and doable for whoever is looking to improve how they eat.
And so with that in mind, does that also apply to dietitians in the retail space? So folks that, not just those that are helping from the clinical side, but also in the retail space?
Absolutely. In fact, many retailers are including dietitians in the stores. I am actually in the corporate office, but I'm available through the website, through email, through programs like this, through community events. You can reach out and ask questions. You can, there are some programs across the country that have dietitians actually doing some clinical care and even just education right in the aisles of the store. So I really encourage people to take a look at the store you usually shop in. They will have nutrition information probably on their website. They will have recipes with nutrition facts on them. That's a great way to search and find some new things that are going to be in the store. Then the other opportunity is to something that's just not even normally thought about, but remember that a lot of stores also have pharmacies, pharmacists, and even blood pressure kiosks. So your grocery store really can be very much part of your health journey. We are there, and a lot of people do. Science has really shown us that people definitely trust their grocery stores to be part of helping them eat more healthfully. So
on that topic, so I've got 3 boys at home, ages 6, 4, and 2, and so we're balancing trying to provide healthy food with just trying to get them to eat and keep going with school and extracurricular activities and everything else. So we do some processed foods, but just curious, are all processed foods bad, or what do you recommend in terms of finding the good ones?
Sure. So let's make sure we keep the word processed in context, right? When we talk about processed foods in health, we're often saying, you know, be careful about things that are high in salt, high in saturated fat, maybe high in sugar, right? And don't have a lot of other nutrition benefits to them. Again, that doesn't mean never. It means, again, how much and how often. Yes, and you have a family that is all in different stages of growing and activity and things along that line. So you're busy, right? And again, the whole idea or opportunity of eating well is to also look at how food products can help you get there. When we think about the word processed, a lot of foods are processed just in their basic form. Those Quaker oats had to be picked and processed to go into that container. No salt added canned fruits and, no salt added canned vegetables, no sugar added fruits, frozen, unseasoned produce. Those are all processed foods that are very, very useful for making a quick meal for a busy family. I'll give you an idea. So for example, you're gonna swap your regular pasta for a whole grain pasta. You're gonna have a local, delicious lower sodium pasta sauce. And especially if one of those boys is a little fussy about how many vegetables you are putting on their plate, you can pop a can of no salt added diced tomatoes into that sauce. Doesn't look any different, nothing new there. You can even scoop a cup of frozen spinach into that sauce. And now you have triple the vegetable power that you had before, but you didn't spend a lot of time doing that. And those are the ways that dietitians really try to help people kind of move that benefit and flavor into how they eat. Another thing to do is to look at how you do that at home. You know, do you have the tools to ensure you can really keep flavor at the center of this, make it so that they can't wait to have that pasta dinner because they're gonna have this delicious meal. So, you know, some things I brought today to keep in mind, things like a grater. You can grate carrots into that sauce. Again, they wouldn't even know, right? You can grate apples into coleslaw. You can, you know, you're processing that food when you're doing it, right? So that's one opportunity, something like a garlic press, just to give something a little pop, you know, and that's something one of your boys can do. So you're helping them learn how to use things and cook. All of the ways we can season. Right now, I mean, one of the things I think is really awesome is people are paying more attention and they're asking the market for more no salt type convenient flavorings. I've got Tony Chicheri's no salt Creole seasoning here. So Cajun, Creole, barbecue. This is one that absolutely meets that need. And McCormick has a perfect pinch salt-free. The one that started all that was Mrs. Dash. So think about the Dash diet, Mrs. Dash, no salt seasonings. One came before the other, and I don't think that's very important, but they certainly partner up well when you're trying to enjoy something in a quick and easy way. Another one is things like lemon juice, lemon zest. You can squeeze lemon, orange, some lime. Literally what makes our mouth water is citrus. So it's kind of a secret, but not so much. You can use it in so many different ways to brighten up any meal.
So when life gives you lemons, make a healthy meal.
You got it.
But in between meals, right, we're all victims of the need. You know, we get those cravings, we're hungry, you know, on the go, certainly, but also even, you know, on the Zoom, right? We're sitting down in front of our computers a lot these days. What are your recommendations for some of your favorite healthy on the go, or as it were on your bottom, snacks?
So one would be, especially if you're feeling like you're a little bit hungry, you know you're going to be doing something during lunch, right? One thing that I like to have handy is a low-fat dairy mozzarella cheese stick. It's got a little protein, calcium, kind of gives you know, your system a little bit something to calm down and enjoy. Another one of my absolute favorites for sweets, I eat them almost every day, are pitted dates. It's like nature's caramel. I put them in my oatmeal. I eat them as snacks. I take them, they're easy bagged and they can go with you wherever you like. They are also another thing that you can use in a lot of different types of recipes. And nuts. I particularly like smaller kind bars or just pecans or walnuts. I mean, those are really easy. Again, super nutrient dense and satisfying foods that can help us, hold us over, add to that plant power that we're trying to do as part of our diet, and be satisfying and enjoyable.
Thank you so much, Elly. And of course, audience members, if you have any questions, by all means, please put them in the chat box. And we've got some questions that have already come in. So right now, Linda, I'm going to ask you to join us back on screen, and we'll begin the Q&A portion of the program. And I believe Christy has the first question ready to go.
Yes, our first question is, how do substitutions affect taste? For example, applesauce instead of oil or avocado instead of butter?
That's a great question. Is it okay if I hop in, Elly?
Go for it.
So this is a personal favorite of mine because in earlier years when my kids were younger, I was constantly sneaking things in and substituting things in. And let me tell you, you cannot tell. Of course, they know my tricks, now in their 20s. However, the avocado, you don't taste it. I've made, the brownies with the avocado. There's a chocolate mousse. But keep in mind, when you do make some of those substitutions, sometimes the recipes then can be higher in other things. So in other words, if you make the healthy avocado chocolate mousse or what have you, the recipe obviously still has some form of sugar or sweetener. It might be a guave or something like that. But, it doesn't mean you're going to eat the whole portion that you made. You're still going to individually have it as a treat, because chances are it's also high in, perhaps some sugar or something. But we've added in the avocado, the applesauce to all kinds of baked goods, and you cannot tell. And I loved Elly's ideas too for, putting in carrots, slicing those up, grating them up. I've hidden it in meatloaf, all different kinds of things when you start to, really brainstorm either with your dietitian or start to, just try something, in your refrigerator. So yeah, you won't notice the taste at all.
My swap for applesauce, I use applesauce in my stuffing in turkey.
Mm-hmm. Nice.
Absolutely delicious, great moisturizer.
Yes.
And that's another thing it does, right? It helps retain moisture, which is really part of what oil or butter would have done as well. So
Absolutely. Absolutely.
Another question, what is a serving size of vegetables and protein? Sometimes the serving sizes can be confusing.
So yeah, Elly, do you want to start with this one?
sure, actually, but I am going to refer you right back to Linda's resources with MyPlate. MyPlate resources really outline these very well, but the standard really is a cup of raw fruits or vegetables, or a half a cup cooked. So those are pretty easy. Again, remember what I said about trying to double or triple how much you have in a meal, kind of tweak that quantity. So if you think about that with cooked spinach, a cup and a half of cooked spinach is really not that much. And you have 3 servings right there in one meal. So you're already, well on your way to do a great job with that. If you think about it from the size of fruit, like the way Mother Nature packages it, an apple, a medium apple would be considered one serving, or an orange. Those big giant Honey Crisps, awesome to share. Split it, and now each of you, whoever you're sharing it with, have a serving of fruit. With proteins, it's really more about kind of a deck of cards size, or the size of your palm. So that's a handy guide for that 3-ounce type serving. And that really applies to seafood or any kind of meat like pork or beef, and it also includes some of the plant-based protein alternates, the meat alternates that are on the market these days.
Was there anything more, or do we have another question, Christy?
Yeah, we have another question.
Okay.
What if you have low blood pressure? Do you still need to limit sodium?
Linda, go right ahead.
Want me to grab it?
Yes, please.
So again, excellent question. I too tend to have low blood pressure. So I would say it's really a conversation first that at some point you want to have with your physician, because it depends how low, right? You know, obviously if you routinely have low blood pressure when you're in your doctor's office, or if you go to a walk-in clinic for that matter, if it was, you know, alarmingly low, they're going to have usually that conversation with you. You know, so it's one of those, you know, you might be okay adding a little bit of salt to your food. I sometimes still use salt. It depends, but I have, you know, the low blood pressure. I think I'd still direct you to your physician. Again, each one is an individual, so it's one of those that you have to evaluate that way. So I don't know if I answered that question.
I think so. I mean, you know, again, there's no benefit to excessive sodium for most people either way, because it has other impacts,
Absolutely.
right? So, it would be kind of rare for your healthcare provider to solve that problem with salt. So the opportunity there is really make sure you're working with your healthcare provider on your health.
Our next question, the DASH diet was mentioned. Can you explain why healthier eating lowers BP? So this kind of goes in tandem with the last question about meals and blood pressure.
Yeah, and I think Elly touched upon it too. So again, you know, it has to do with when we eat a lot of sodium, it, you know, causes us to retain extra fluid, and so our body, you know, can swell. You might not necessarily always notice that you're a little swollen or whatever, but it causes the heart to have to work harder, right? So when you consume all of the processed foods, if you're eating chips and then, you know, maybe you're using, you know, a packaged soup, right, which is super high in sodium. So all that, you know, causes our body to then have a cascade of reactions, leading to high blood pressure and all of the diseases associated with that.
Just to add a little bit to that, you know, the benefits of that variety of foods and why MyPlate is set up that way is because there are nutrients and minerals in each type of foods. So in the whole grains, in the fruit and vegetables, in low-fat dairy or dairy substitutes, that all contribute parts to that diet. And actually those nutrients are part of how that your blood pressure is lowered. When your blood pressure is high, what Linda said about your body retaining fluid is it's also that sodium gets high in your bloodstream and in your artery, and it actually pulls more fluid into your artery. So that's part of what makes the pressure go up. So here's an opportunity to use all this benefit, all these wonderful foods and the way your body's designed to absorb all these nutrients to protect your brain, your kidneys, your arteries, your circulation. You know, what an opportunity to enjoy a healthy lifestyle and have it love you back, right? By helping and protecting your heart.
So I've got a question as it relates to trying to do all of this, particularly in the environment we find ourselves in these days. How do we do this in a cost-effective way? You know, how do we make sure that we're eating healthy, particularly with families that are on a budget or that want to make sure that they're not, you know, spending the whole paycheck at the grocery store, but also trying to do their best to eat a heart healthy and overall generally healthy diet?
Absolutely. Either way, I'll hop in and then.
Yeah, please, Linda, go right ahead.
We both have plenty to offer there.
I'm sure.
So again, a perfect time to start looking at farmers markets. Again, when we shop local, you know, we're usually paying less because you're not also transporting it that way. Look for sales. Elly, I'm sure, can speak to the supermarket venue, but look for those sales. And often, you know, if you get a sale on something, say it's frozen veggies, you know, if you have space in your freezer, you can keep those and have them for when you need them, either in a pinch or in a blink. And again, canned isn't a horrible thing. Of course, look for no added salt first, but canned foods, often the supermarkets have the can sales, right? And
10 for 10.
Relatively inexpensive source of protein. So, you know, stock up on those when you have that ability or storage space to do that as well. Elly, I don't know if you want to elaborate a little more.
Yeah, let's go back, Ken, to your question in the beginning about that list, right? I mean, if you're making a list and you're just, looking at, how do you have a couple of ideas for healthy breakfasts in the morning? That might be yogurt and fruit and some granola, might be Morgan's smoothie a couple of other days, but all of those things can be made, even Morgan's smoothie. She did an awesome job with her fresh produce, but you can do that with frozen produce. You can do that with canned produce. So you have opportunities there to look at things and, even just mix and match with what you already have at home. That was one of the things we brought up earlier. Look at what you already have, use it up. Allrecipes.com, a great place to find some recipes for salt-free seasonings, but it's also and a lot of recipe websites now allow you to put your ingredients in and find recipes, as opposed to you putting in a recipe idea and having to find one that way. So they really, they're getting more and more and more capacity to help shoppers with what they already have, what they like, or just to make tweaks to things they usually make. Another is just to, again, keep it simple. Look at your serving sizes, right? Cost and serving sizes also come together as well. So look at those serving sizes, tweaking some serving sizes for some of the things you usually purchase, often means you're still getting plenty, but you're also managing your costs and your budget.
That's great. Yeah. And even too, I don't know that you have time to show it, but there's that recipe for the Three Sisters salad. So not only is it cost effective, but it's delicious. And it's, just a dish that you can make it in a certain quantity and then use it throughout the week by adding in pasta or grains. And the concept behind it is that the Native Americans planted the corn, the beans, the zucchini, three sisters together, they helped each other in the garden to grow. So again, the dish is loaded with fiber, it's packed with nutrients and protein and low sodium and cost effective because you could have it one afternoon as a lunch. You could then have it by expanding it with some whole grain pasta or rice, for dinner the next meal, and then kind of even add it to a spaghetti sauce another night. So that's how we have to start doing a little more planning ahead.
Right, but it's also not that hard to take that same salad, put in a can of no salt added diced tomatoes.
Mm-hmm.
You can squeeze a little bit of lime juice on it, and now you have a really awesome snap ed recipe called cowboy caviar.
Yes.
You take that cowboy caviar the next day and you can use it as a topping for your broiled whitefish or chicken, or you can use it as part of your tacos. You can put chopped mango in it. Now you've got something that's, you're calling company to come over and enjoy that with you. So
or put it on your potato or salad.
Really.
Yeah.
So there's really, a lot of great ways. And again, we're all being a lot more conscious about food waste. The number one most recycled and recyclable package is a can. So, stock your pantry to support your pantry. And you can really, find a lot of ways to enjoy a lot more foods. More canned foods also means more potassium, more fiber, all a lot more affordable.
Yeah.
There has been so much great information here. Thank you both, and thank you to all of our speakers and the sponsors that you'll see on screen for making the Check It Challenge possible. This has been a great event. We really, really do appreciate all the insight, and I know we're close to our time, and I, for one, really feel compelled to go get something to eat. I've got all these great ideas. So again, thank you to everyone today. Thank you to today's presenting sponsor, Tompkins Mahopac Bank. And last but certainly not least, thank you to all of you in the audience for joining us today and for all the great questions and insights that you shared in the chat. So one final thought, be sure to save the date. Your registration from this event gives you access to our next Check It Challenge community conversation, which is on Wednesday, April 27th at noon. Move more for lower blood pressure. So that's presented by PCSB Bank and Ellis Medicine, and we hope to see you there. In the meantime, be sure you're checking that blood pressure. Make sure you try to maximize all the information you learned today to create more heart-healthy recipes for yourselves and your family. And thanks again for everything you've done. And let us know how you're doing. Tag the American Heart Association at AHA New York, or on Facebook and Instagram, and on Twitter using the hashtag #CheckIt. And with that, we will say have a wonderful afternoon. Thanks again so much for joining us. Take care.
Bye, everyone.
Bye, thank you.